the need for treating patients with venous insufficiency was so huge. There were so many patients who had almost crippling pain in their legs because of venous insufficiency, and they just were not being treated, that their need was not being addressed. Right here in the Washington, D.C. area at that time when we started, there was nobody treating venous insufficiency. And then as we got further and further into it, we realized that this was a massively undertreated disease throughout the country and throughout the world. And a lot of research had to be done. A lot of new technologies had to be introduced. And when we got into it, we did not know how undertreated this subset of patients was.